So today's class is on pathology. The first topic is cellular adaptation. So we are going to see how a cell will respond to an injury. So there are different types of cellular responses to certain injuries or certain stimuli. Same like that of a touch me not plant. So whenever we touch that touch me not plant, the leaves will immediately get shut down or it will close, right? So similar to that, every cell of our human body will respond to the stimuli which we give or the type of injury. So if you see, the response will be um, based on the nature of the stimulus or the severity of the stimulus or the severity of the injury. So if the nature of the stimuli is something like non-lethal or it is not affecting that much or a mild level of stress or injury is there, then our cell respond in a way that it will start or try to adapt to that kind of injury or that kind of stimuli. So cellular adaptations are those kind of adaptations where the cell try to adapt to that kind of change or the injury or the stimuli. So if the stress or the injury is acute, mild and transient, for example, like oxygen deprivation, whenever you go beyond the level of your atmospheric pressure, just like up in the sky or down into a sea, or some physical agents or chemical agents, or in some bacterial infections or fungal infections or viral infections. In such cases, the severity of the injury will be acute, mild, and transient. That time, the cell will be having a reversible injury, depending upon the severity of the injury. Okay. So, reversible cell injury has two types of cell injury. Either it go for cellular swelling or there is fatty changes. If the injury or the stimuli is severe and it is progressing every day, then the reversible cell injury can become irreversible cell injury, and ultimately the cell will undergo death in either the way. Either it will undergo necrosis or it will undergo apoptosis. Other than that, we have intracellular accumulations. That means inside the cell there will be some components of the cell itself, like your glycogen, the stored form of glucose, or the lipid, or the water content. It will start accumulating when the cell is having all these normal constituents in an abnormal quantity, or some abnormal constituents which is coming into the cell, inside the cell, like your pigments.
Madam,
Sir?
Madam, actually, you have to make slideshow. Resume to slideshow on top, some option is there, no? You just click on that.
Resume to. Sir, I have audio, video, participants, chat, share, pause,
No,
layout.
on top. Slideshow, some option is there, no?
In the PPT, sir?
In the PPT, on top, not PPT, madam. On top of that system, you will get some few options. See, hide slide. Yeah, setup slideshow. Yeah, here, man. So otherwise, you take this slide to down, madam. Just see a basic, there in the base also some option will be there. Here, some option is there. No, you just click on that. Below, one option is there that besides 60 before. Yes, you just click on that.
Is this fine, sir?
No, madam. 60% it's showing. No.
Okay, so I have
So
to make.
before that. No, before that. That option you have to click on that.
Yeah, in this only I was talking, sir.
No, madam. He was talking, but here no. What I am seeing, only slide I am seeing, not in slideshow.
Okay. Now, sir?
Just a minute. No, also same thing.
But for me, it is showing. I will take a picture of my screen, sir.
Uh-huh. No, you do one thing, madam. You come out of that and
Okay.
again redo, because sometimes it will happen. So same thing will be recorded. So then the slideshow won't be visible actually. Just stop sharing.
Okay.
Stop sharing. So then again start sharing.
Now, sir?
Now also same thing I'm getting. Now okay, madam. Done.
Okay. Sir, can I start from the beginning?
Yeah, madam, please. Now you can start.
Okay. Okay, sir.
Thank you, madam.
Okay, thank you, sir. So today's class is on pathology. The first topic is cellular adaptation. So cellular adaptation means how a cell will adapt to the response, or how the cell will respond to a stimuli or any kind of injury it is getting. So we'll see what are the kinds of cellular adaptation and how will we proceed into cell injury. So there are different types of cell injury, or the depending upon the nature of the stimuli or the severity of the stimuli, the way the cell responses will vary. So we can see what are the non-lethal. Sometimes there will be some non-lethal type of stimuli, any altered or changed physiological stimuli, where the cell try to adapt to that kind of change. So under cellular adaptations, you have hypertrophy, hyperplasia, atrophy, and metaplasia. Sometimes the cell respond to different kinds of injury, like some injury will be mild, acute, and transient. For example, whenever we have an oxygen deprivation or some atmospheric pressure changes, like when we go up in the sky in an aeroplane, or you are going to do a scuba diving down into the sea, or any physical agents like any thermal shock or any radiations, or any chemical agents like some strong alkali acids, or some air pollutants, or any therapeutic drugs which you are taking, or any infectious agents like your bacterial infections or the toxins they produce, viruses, or any fungal infection. So, depending upon the severity and nature of the stimuli, if the cell injury is like, or if the injury is like acute, mild, and transient, the cell will undergo reversible cell injury. For example, cellular swelling or fatty changes. If the same injury or the stimulus persists, or the nature of the stimuli is getting severe, or it is again progressing, it will go for irreversible cell injury, and ultimately the cell will die. Either in it will undergo necrosis or it will undergo apoptosis. And we have intracellular accumulations. Intra means within. So within the cell, there will be some accumulations inside the cell. For example, there will be some constituents of the cell, like your water content. So 80% of the cell will be made up of water. So if the water content is getting in an abnormal or an increased percentage, then the water will get accumulated inside the cell, or the lipids, or the proteins, or the glycogen, the stored form of carbohydrates, or else any abnormal things which is coming inside the cell, like your pigments, the inhaled carbon particles during some air pollution, or some tattoo pigments. So, other than that, you have pathological calcification and you have cellular injury. So, what we are going to concentrate upon today is your cellular adaptation. So adaptation means they are a reversible changes in the size, number, phenotype, metabolic activity, or the function of the cells in response to change in their environment. So you have four different types of cellular adaptations. First one is hypertrophy, hyperplasia, metaplasia, and atrophy. So you have two trophy, two plasia, hypertrophy and atrophy, hyperplasia and metaplasia. So hyper means high, increased. So trophy you can relate it to the size. So hypertrophy means increase in the size. Increase in the size of the tissue or the organ due to increase in the size of the cell. So hypertrophy, usually the cell, it has a normal size. When the size of the cell is increasing, that condition is called as hypertrophy. So it usually occurs in the tissue which is incapable of cellular division. That means if the cell is unable to divide or increase in the number, in that kind of cells only you can see hypertrophy. So you have two types of hypertrophy. One is um, physiological and pathological. So physiological means something which is normal, which is happening normal in our body. Pathological means something which is seen in a diseased condition. So you will have physiological hypertrophy and pathological hypertrophy. So we will see what is physiological hypertrophy first. So physiological hypertrophy, for example, hypertrophy of the skeletal muscle in bodybuilders and athletes. So you would have seen a lot of bodybuilders and athletes having their um, upper arm muscles or lower leg muscles which is swollen or which is round or being in a good shape rather than a normal human being, right? So in bodybuilders, when they start taking the weights like 10 kg or 5 kg dumbbells every day, that becomes a stress or a stimuli for the skeletal muscle. So our skeletal muscle will try to adapt to that kind of stress. So what will happen to the skeletal muscle? It will increase in the size. So that is called as hypertrophy of the skeletal muscle in bodybuilders or athletes. The second thing is, or the second example is hypertrophy of smooth muscle of the uterus during pregnancy. So during pregnancy, we all know that the size of the uterus will become large. So in this picture, you can see in the left side, this is the uterus of a pregnant woman, and this is the uterus of a normal woman. So see the size change. So you can see in the smooth muscle of the uterus, you can see hypertrophy. Hypertrophy means increase in the size. So these two are the examples of physiological hypertrophy means which happens in any normal person, right? So it is not under a disease condition. So that is physiological hypertrophy. Pathological hypertrophy means in any disease condition because of the cell injury or the cell stress, the cells are getting increase in size. That is called as pathological hypertrophy. So if you see in a condition called as left ventricular hypertrophy. So in left ventricular hypertrophy, this is the heart. So you have this is the cut section of the heart. So if you see, you can see the left ventricle as well as the right ventricle. This is the anterior wall and this is the posterior wall of the heart. So if you see, this is a normal heart. So in a person with hypertension, where the BP is high, blood pressure is high, or the person has a damaged valve, what will happen? The blood pumping capacity of the heart will decrease. But the heart wants to pump out all the blood, which is coming inside the ventricle. So what happens? The ventricle will undergo, or the left ventricle will undergo hypertrophy. The cardiac muscles which is present in the left ventricle, that will undergo increase in size because of the hypertension and the or the damaged valve. So if you see, you can see there is an increase in size of the myocardiocytes present in the left ventricle. So ultimately, what will happen? There will be an obliteration of the lumen. So you can see in the morphology, you can see as gross, you can see the normal heart cut section and the left ventricular hypertrophy heart. And this is a microscopy of LVH, where you can see, and this is the normal heart microscopy, and this is the microscopy of a heart with left ventricular hypertrophy. So you can see increase in the size of the cells. The next example for your hypertrophy is hypertrophy of smooth muscle of the urinary bladder muscle present in benign prostatic hyperplasia. So in normally in males, you can see a prostatic gland in either side of your urethra. So you have kidney which is connected with your urethra, which will empty into your bladder, and from the bladder the urine will be drained out from the urethra. So in females you have this, in male you have in either side of the urethra you can see a prostate gland. So in person more than around 55 to 60 age of year, you can see some people will have this prostatic gland enlargement. So that condition is called as benign prostatic hyperplasia, where you can see nodular hyperplasia of the prostatic glands. So what will happen? There will be a number increase in the number of the cells inside the prostate. So what happens? The size and the structure will become bigger, which will in turn push your normal your bladder, urinary bladder, and it will start constricting your urethra. Okay, so what will happen? Ultimately, the bladder will be filled. The person will have an urge to pass the urine, but because of the constriction or because of the constriction of the urethra by the prostate, which has undergone BPH, the urine will not completely move out of the bladder. So the bladder will have all the time, it will be have some amount of urine. That itself causes a stress to the urinary bladder smooth muscle, and that stress will undergo hypertrophy of smooth muscle of urinary bladder. So the bladder muscles, the smooth muscles of the urinary bladder will undergo hypertrophy, which means it will increase in the size of the muscles, smooth muscles. So we have till now we have completed your hypertrophy. So hypertrophy means increase in the size of the tissue or the organ due to increasing the size of the cell. Almost all the causes of hypertrophy is because of the increase in functional demand or the workload. So that is the cause of hypertrophy. So we have two types of hypertrophy. One is physiological hypertrophy, where you can see hypertrophy of skeletal muscle in athletes and bodybuilders, and hypertrophy of smooth muscle in of the uterus during pregnancy. And you have pathological hypertrophy, where we can see hypertrophy of cardiac muscle in left ventricular hypertrophy and hypertrophy of smooth muscle of urinary bladder in benign prostatic hyperplasia. So this ends your hypertrophy. Next, we are going to see hyperplasia. So hyperplasia means increase in the number of the cell of an organ or tissue, resulting in increase in the size or mass of the organ. So here also we have two types: physiological, which is normally happening in every person, and pathological, only seen in a diseased condition. So physiological hyperplasia, almost all people will undergo this hormonal hyperplasia, either they are male or female. So in females, during our puberty, we have breast development. So that is because of our hormonal stimulation, normal hormonal stimulation, which will help the cells to increase its number. So hormonal hyperplasia usually seen in the glandular epithelium of female breast during puberty, and during pregnancy we have already seen the increase in the size of the uterus, the muscles present in the uterus, smooth muscle hypertrophy. The same thing will undergo hyperplasia also. So during pregnancy, the uterus muscles will undergo combined hyperplasia as well as hypertrophy. We have one more example, which is compensatory hyperplasia. Compensatory hyperplasia in a liver degeneration. For example, let's take an example of a severe alcoholic. An alcoholic person who has a habit of consuming alcohol every day for, let's say, for 5 to 8 or 10 years, maybe. So in that person, the liver would have undergone to a maybe liver cirrhosis. So what will be the options or treatment option for a advanced stage liver cirrhotic patient? Last sort of treatment may be it may be a liver transplant from a healthy donor who is compatible, right? So a healthy donor is coming and he's ready to donate the liver to that patient. So what happens to that healthy donor after partial hepatectomy? So what is partial hepatectomy? The donor is giving a part of his healthy liver to the recipient. So a part of the liver is getting transplanted from a healthy donor to a recipient who is a patient. That terminology is called as partial hepatectomy. Partial means maybe half or a portion. Hepa means liver. Ectomy, anything ending with ectomy means removal. So removal of liver cells, not completely, it is partial. So from a healthy donor, the liver is getting taken, a part of the liver is getting taken and getting transplanted to a patient. So what happens to that healthy donor after a part of liver is lost? For compensation of that lost liver, what happens? This liver will undergo regeneration by the process of physiological hyperplasia. The cells will start regenerating with physiological hyperplasia. hypoplasia. That is also an example of physiological hypoplasia. So we have 3 examples of physiological hypoplasia. One is female breast development during puberty, then uterus development during pregnancy, and compensatory hypoplasia, where we have seen liver regeneration following a partial hepatectomy. All these are seen in physiological, not in normal persons. Now we are going to see pathological hypoplasia. That means in diseased condition. So usually we have seen this hormonal stimulation in physiological hypoplasia. When this stimulation or the hormonal stimulation goes for excessive or not in optimal level, it is going for an excessive hormonal stimulation. For example, in female, let's say a female of 45 years of age, she is having an excessive hormonal estrogen stimulation. So she may end up with having an endometrial hypoplasia, which again in few years can or may become endometrial cancer, right? So this is the uterine hypoplasia. Or in males, you can see because of excessive androgenic stimulation, the person may go for benign prostatic hyperplasia. So let's take this example, uterine hyperplasia. So this is a normal endometrium of a 45-year age female. So you can see the ovaries, fallopian tube, uterus, right, the wall lining the uterus. So if you see the endometrium, myometrium, and perimetrium. So if this hormonal stimulation is excessive in nature, you can see a thick wall lining in the endometrium. So this means the cells are getting increase in number. So this condition is called as endometrial hypoplasia, which may become endometrial cancer in future in that patient. So that is an example of pathological hyperplasia. And another example is the benign prostatic hyperplasia, which we have seen in this condition. So this is the normal prostate. This is an abnormal prostate where you can see nodular growth inside the prostate. This condition is called as benign prostatic hyperplasia. And this, in some injuries, chronic injuries or irritation, like long-standing inflammation or chronic injury, also can lead to hyperplasia, especially in skin or oral mucosa. So we have finished so far hyperplasia and hypertrophy. Hypertrophy means increase in size, and hyperplasia means increase in the number of the cells. Okay. So this is the benign prostatic hyperplasia, where you can see the normal prostatic gland, and in a 60-year-old male, you can see enlarged prostate, where this condition can become BPH, benign prostatic hyperplasia. So far we have seen hyperplasia. You can see 4 cells. If this cell with the same size is only increase in number, that condition is called as hyperplasia. If there is 4 cells, it is only increasing the size, not in number, that is called as hypertrophy. You can see combined hypertrophy and hyperplasia. Classical example is the uterus muscles during pregnancy. The next portion is atrophy. Atrophy means reduction in the size of the organ or tissue due to a decrease in the cell number or size. It also can be physiological or pathological. So physiological atrophy, usually in the embryonic life, we can see it is not common during your normal development. Embryonic structures like your notochord or the thyroglossal duct, from where our thyroid glands are developing in the embryonic or fetal life. After all these structures are developed, this thyroglossal duct undergoes atrophy, which means it will shrink or it will reduce in the size during the fetal development. Okay, so this is a classical example of embryonic structure which undergoes physiological atrophy. We have examples during our adult life also. involution of thymus. After around 20-25 age, our thymus will not grow. It will reduce its size. Atrophy of brain or gonads or heart during aging, that is called as senile atrophy. So uh, our brain or our heart will be in a normal size during your young age. So when we are moving to the older age, like becoming aging, our heart and brain will start shrinking. That condition is called as senile atrophy. This happens in almost every human being, and it is not seen in any disease condition. So that is why it is classified under physiological atrophy. That is happening normally in the individual. Okay. So next is our pathological atrophy. That means atrophy, the reduction in size usually seen in a disease condition. So pathological atrophy can be divided into local or generalized. Local means in a specific area or an affected area only we can see the atrophy. For example, we have given um, three examples. So we have disuse atrophy. Disuse atrophy means we are not using the particular area. So because of that, the area, the workload or the functional demand is less. So the cells are getting reduced in number or reduced in size. For example, in case of a fracture, if there is a accident or a fall from height, the person is getting multiple fracture in his limb or her limb, either in upper limb or lower limb, arm or leg. So the person will go for a plaster of Paris. They will be put under plaster of Paris or a cast for at least 3 to 4 months or maybe 6 months or 1 year. So what will happen to that limb muscle? The limb muscle will not be moving. So they will put the plaster of Paris for immobilization. They should not move their limb so that the healing of fracture could be happening, right? So the limb muscle will not move. So what happens to the muscles? The muscle will not have any work. The contraction and relaxation of the muscle will not happen. So there will be a decreased workload and the limb muscle cells will undergo atrophy. That will be reduced in size and number. Or the same thing we can see in a prolonged bed rest patient. So that kind of atrophy is called as disuse atrophy due to decreased workload. The second example is here for the local pathological atrophy is your denervation, or denervation means loss of innervation. So because of that, we are getting atrophy. For example, in polio, what happens in polio? This polio virus will damage our nerves. So whatever muscle is getting supplied by the nerves, that muscles will undergo atrophy. That is called as denervation atrophy. The third example is your, let's say, ischemic atrophy. For example, the brain will undergo atrophy when there is an ischemia produced due to some atherosclerosis of the carotid artery. So that also is an example of your pathological atrophy. Like whenever there is an atherosclerosis in the carotid artery, that will lead to ischemia. Ischemia means decreased blood flow. So because of diminished blood flow to the brain will undergo atrophy. That is called as ischemic atrophy because of diminished blood supply. That is also an example of local atrophy. One more example I can give you is pressure atrophy. So we have seen previously the BPH condition, benign prostatic hyperplasia, right? So whenever in BPH patient, you can see the bladder is almost filled with urine all the time. So after a point of time, the urine will start getting trapped in the kidney and the ureter. So you will get a condition called as hydroureter or hydronephrosis, which is very fatal. So the kidney with hydronephrosis will have pressure atrophy in the renal parenchyma. That is also local. It's only happening in the kidney, right? So that is called as local atrophy. Generalized atrophy means you're getting shrinkage or reduction in the size of the whole body. For example, in starvation, or if you see in underprivileged children, you can see them like very less muscle mass. Or if the person is getting starved, or the person is getting inadequate nutrition, protein allergy, or protein calorie malnourishment, that person will undergo generalized atrophy. So we have finished hypertrophy, hypoplasia, atrophy. So this is the atrophy, senile atrophy. So this is the normal brain. Where you can see the sulci and gyri without any space. In an atrophied senile brain, in an aged person, you can see the sulci and gyri with a lot of spaces in between them. So this is called as senile atrophy. And the size also is getting reduced as you compare with the normal brain. The last portion is your metaplasia. So metaplasia is also a kind of cellular adaptation where you can see one kind of cell type, either the epithelial cell type or the mesenchymal cell type, is getting replaced by another cell type. So you have two types of metaplasia. One is epithelial metaplasia, and the other one is connective tissue or mesenchymal metaplasia. So we can see first what is epithelial metaplasia. So in epithelial metaplasia, one kind of epithelial cells will be replaced by another kind of epithelial cells in some kind of diseases. So you have again the epithelial metaplasia is classified into two types. One is squamous metaplasia, another is columnar metaplasia. So for example, let's see this squamous metaplasia. So in squamous metaplasia, usually seen in the smokers, cigarette smokers. In a habitual cigarette smoker, the normal cells, which is lined in the trachea and bronchi, will be this kind of cells. Like you can see cilia, and the cell is look like a column. So this cell is called as the normal ciliated columnar epithelial cells. So these are the cells which is lined on the bronchi as well as your trachea. So when the cell is getting exposed to the cigarette smoke, which contains a lot of chemicals, carcinogens, the cell will try to adapt, right? The cell will try to adapt to that kind of stress or the smoke, which is getting exposed to the chronic irritation. So in response to the chronic irritation which occurs in the respiratory tract, the tall, ciliated, normal columnar epithelial cells of the trachea and the bronchi usually will get replaced by stratified squamous epithelial cells. So this transition from the ciliated columnar epithelial cell to the squamous cells are called as squamous metaplasia. The second type of um, metaplasia is, or epithelial metaplasia is usually seen in columnar kind of cells. For example, you would have experienced this at least in once in a lifetime. Whenever you have a full, complete meal, you will have a regurgitation of the gastric content up till your throat, right? A sour taste will be there till your throat and it will go back. So that there is a disease condition where it is called as GERD, gastroesophageal reflux disease, where this kind of regurgitation of the gastric content happens every time. So in that kind of person or in that kind of patients, what happens is that the esophageal cells will be the squamous cells, the squamous epithelium. So this squamous epithelium will not have the ability to exposed to this high acidic content every day. So what happens? This squamous epithelium of the esophagus will get replaced by the columnar cells because of the exposure of the acid, where you can see gastric content is having acid. So the squamous epithelium of the esophagus will get replaced by the columnar cells. That condition is called as Barrett's esophagus. So in Barrett's esophagus, you can see columnar metaplasia. And in cigarette smokers, you can see squamous metaplasia. Both are epithelial metaplasia. And the second type of metaplasia is your connective tissue metaplasia, where one kind of connective tissue is getting replaced by another kind of connective tissue. Let's say we have different kinds of connective tissue like cartilage, bone, blood, adipose tissue, right? So this one type of connective tissue is getting replaced by another normal kind of connective tissue. For example, bone formation inside a muscle. So that condition, that clinical condition is called as myositis ossificans. Myo means muscle, itis, whatever it is, the term which is ending with itis is called as inflammation. So there will be some inflammation in the muscle fibers, and ossificans, something related to the bone. So there will be bone formation inside a muscle, which will lead to some muscle inflammation. Usually this clinical condition happens after a fracture, where you can see intramuscular hemorrhage. So this type of metaplasia is less clearly seen as an adaptive response and may be result of a cell or a tissue injury. So by now we have seen all the type of cellular adaptations. So hypertrophy means increase in the size. Atrophy means reduction or shrinkage of the size. Hyperplasia, increase in the number of the cells. And metaplasia, the replacement of the kind of cells by another normal type of cells. That is called as metaplasia. So atrophy, hypertrophy, hyperplasia, metaplasia. There's one more condition where you can see the replacement of the cells by an abnormal type of cell, which is called as dysplasia. So usually in cancers, you can see a normal cell where the cell will go for a injury, or the cell may have some stimulus. Then the cell will try to adapt to that kind of stress. So it will undergo hyperplasia, either hyperplasia, hypertrophy, or metaplasia. Then when it undergoes for metaplasia, the cells replaced will be normal cell type. Whenever the cell replaced is abnormal, that condition is called as dysplasia. So the dysplasia will slowly turn into your cancer. So this is the summary of today's class: atrophy, hypertrophy, hyperplasia, and metaplasia. So take home messages. Hypertrophy means it is the increase in size, which usually occur in tissues incapable of the cell division. So whenever you go for writing the morphology, you have to write about the gross as well as the microscopy. So in gross, you can write it as whatever you are seeing with the naked eye. So the organ level, the organ will be enlarged. Microscopy means you're going to see the cellular level. So the cells will increase in size in both cytoplasmic as well as the nuclear. So hyperplasia means hyperplasia occurs in the cell capable of replication. So it is usually in gross, the size again it is increased or enlarged. Microscopy, you can see increased number of cells in hyperplasia. Atrophy means it is reduction or shrinkage of the cell. So atrophy cell, the death mainly occurs due to apoptosis. Apoptosis will be taken in the upcoming classes. So in atrophy structures, the morphology, gross will be the organ will be shrunk or shrunken, or it will be reduced in size. Microscopy, the cells will be smaller in size due to reduction in the cellular number. Then epithelial metaplasia, we have two types of metaplasia. Metaplasia means replacement of a type of normal cell with another type of normal cell. So you have two types of metaplasia, epithelial metaplasia as well as connective tissue metaplasia. So epithelial metaplasia, again, it is, you have two types, columnar metaplasia as well as squamous metaplasia. Squamous metaplasia is seen in smokers, and columnar metaplasia is seen in Barrett's esophagus. And we have connective tissue metaplasia, which is, for example, as an example, you can write myositis ossificans. So this is the take-home message. And I have listed a few questions also from this unit. The cellular adaptations. What are the cell adaptations? Define hyperplasia, its type with suitable examples. So you have to write in all these four questions. Whenever there is a question asking for the types with suitable example, you have to mention both physiological and pathological. So physiological means which comes under a normal condition, and pathological means in a diseased condition, wherever the cell will undergo any changes. So that's all for today. We'll see you in the next class.
Thank you, madam. Thank you so much.
Thank you, sir. Sir, I think I don't know how I took.
So I think
Maybe,
today you got a good experience.
yeah, yes, sir.
Yeah.
Because during our routine class, we will use the board and all for
Yeah,
drawing
correct.
and all. Yeah, sir. So,
So it will be, I think, first experience. No issue, madam.
yeah.
So I think tomorrow, I think it will be easier for you.
Okay.
So I think next you need to prepare the PPT, next PPT. So once it is
Okay.
ready, so
Yes,
what
sir.
I will do, I will share the link, madam. It would be easy for you.
Okay. Okay,
So
sir.
it will be recorded automatically.
Sure, sir. Sure, sir.
Yeah, madam. Thank you. Thank you so much.
Thank you.
Nice
Thank you.
class, actually.
Thank you, sir.
Thank you. Thank you.